Hi, my name is David Fishman, and I'm an interventional cardiologist at Vitruvian Health. My sister and I are actually first-generation college graduates. So my parents actually are immigrants, and they came to the United States in the 70s. My father's from Russia, my mother's from Baghdad. They had met in Israel, got married, and moved to Cleveland about a year after. I chose cardiology as my specialty while I was internal medicine, training in internal medicine, and when I specifically rounded in the cardiac intensive care unit, I thought that cardiac physiology was the most interesting physiology that I could ever really see, and that really piqued my interest in cardiology and really had me go down that track. An interventional cardiologist is a cardiologist that does procedures for the heart that includes stents in the heart, valves in the heart, typically can also fix blockages in the legs, and in other circumstances can fix kidney arteries, remove clots in the lungs, and other interventional, minimally invasive procedures, depending on the subspecialty and the training. My favorite part of practicing medicine is definitely being in the cath lab and doing procedures, specifically complex procedures. And I just feel that it allows the patients to get the maximal benefit, and when seeing them back in the office, they tell you how much better they feel on doing their day-to-day activity, and that really is the source of the success of the procedure. For the patient who comes to see me, I want them to understand that whether it be preventative cardiology and preventing cardiac disease, already dealing with an existing problem that they're transferring over from a different provider, that their care is number one, and that they should walk in and out of the office feeling that they're the only person in the room. I think making patients feel at ease starts off in the office when you first start testing them, and just having them understand that just looking into the test and understanding what's going on in their arteries doesn't always mean that they're going to require stents or bypass surgery. But even if they do, it's to make their quality of life better and improve just overall what they do on a daily basis. And once you tell them that, then they understand that this is only to help them, and a lot of their anxieties go away. And then I do take time to talk about this procedure specifically, which then allows them to process it before I go over the consent prior to the procedure. The reward for me is patients doing well. If patients are doing well, that's the only thank you that I need, because I know that what I've done for them is improving their quality of life and making them feel well and live longer. What drives me is probably my family, religion, and my work. And in cardiology, like I mentioned, when patients come in and they say, when I ask them, how are you doing? And they say, I feel great. That's almost the end of the visit. That's all you need to know, you know? Most of the time, patients will tell you they feel poor, they feel bad. But that also drives me as well, because that allows me to help them. So on both ends.